So like.
You're good.
Okay, to get started. First of all, thank you all so much for being here today. My name is Michelle. I am the community program specialist for the Alzheimer's Association, Heart of America chapter, longtime volunteer for the association, and now on staff. So very, very excited about that. I wanted to let you all know that this training and these educations that we can do for staff that are working in memory care has kind of been a vision of mine. As a volunteer for many years, we weren't doing something like this. So this is very exciting. Our hope is to continue to maybe do something, an education like this quarterly. So if you all are, great for the folks that are here today, but if you're able to schedule it out maybe and send some more of your staff, the more the merrier. So Bonnie Smith is our community educator today. And she is raring to go, I think. So I think this is going to be great. Thank you for being patient, and we'll get started. Super.
Thank you. Hi, I'm Bonnie. I'm an Alzheimer's volunteer, and so like many of you, I may have less seniority than some of you. I have 14 years in the industry, Justin, 12 years. So I'd like, before I begin, I would just like to get a sense around here. I don't know if we have time or memory to remember everybody's names, but can we just kind of do a real quick popcorn around? Who are you here? Who do you work with? Who are you here working with? And approximately how long have you been working with seniors or with dementia? I want to start with you, Monica.
Sure. I'm Monica Caregivers. I work with Goshen and Operated, and together with the leadership. She's the nurse over there, and I've had Goshen home care since 2019. I've worked with dementia Alzheimer's residents since 2007.
Wow. Okay. Very good.
So I'm Stephanie. I'm with Benton House. I am their memory care coordinator there. I've been working with the industry like 14, actually before Courtney back then.
Linda, I'm Rosa, director at Goshen, and I've been in Homes Plus for 4 years with memory care, and then just in geriatric.
I'm Carol. I'm executive director for Benton House Lenexa. I have a passion for Alzheimer's and developing programs for them. And I've been in healthcare for too long, because if I say it, it's like, no, hold on.
You're reincarnated.
I'm reincarnated, yes. And so I've been in for probably over 20 years. And this is Ivory.
I'll introduce her.
Hi, I'm Tanisha. I'm with Pure Haven. Actually, I don't scheduling.
On-call schedule.
Super.
All right.
I'm actually an LPN by profession. I'm about 8 years as a nurse, 20 years in healthcare, and maybe about 3 in the.
And Tanisha and I went to high school together.
Yeah. She's the one that.
You're gonna have to see, if we have extra time, you guys can sing your school song.
I wasn't there.
Kind of all time, and you can't remember the school song.
We all have a little bit of it.
I'm Courtney Goen. I work at Pure Haven Homes, director of operations there. Been in Alzheimer's and dementia care since 2007. I think a 9-year volunteer like Michelle for the Alzheimer's Association. Just a passion of mine. Yes. Thank you, Michelle, for putting this together. So, and yeah, I mean, this is so important because there's such a staffing shortage right now, as we all know in this room, for good caregivers. And so I think, unfortunately, a lot of facilities are putting up with caregivers that aren't so great because we just have to have staffing. And so communication always, I'll shut up. But this is so needed. So thank you, Michelle, for putting this together. Of course.
Oh, okay, I'll go. My name is Megan Miller. I am with Novus Life Care Hospice. I'm also an independent contractor for Senior Care Authority, and I am the new chair for the Wellness Day. So yeah, absolutely, I'm very excited. I have about 15 years of personal experience of taking care of my grandmother with dementia. And then about 5 years of professional and senior care throughout pretty much every level of care. So very excited about this.
I'm Brooke Bollinger. I'm with Novus Life Care Home Health and Hospice, and I've been in hospice for 15 years. So I've just got a lot of experience with memory care, as well as I'm a new volunteer for the Alzheimer's Association. So
I'm Pam Ember. I'm with VITAS Hospice and about 13 years in healthcare, and my mom lived with us for quite a while with Alzheimer's, and Michelle was actually, where'd she go? Michelle was actually, when we did put my mom in a community, Michelle was her activities director, so that was my first.
They might go way, way back.
That's awesome. Yeah.
Don't you just love all the synchronicities?
Yeah.
Yeah.
So I'm Tina. I am the nurse at Avenue 1. I have been in healthcare for 18 years. I have family members who have walked this life. So just trying to use my knowledge to here.
Christine, been in this for 14 years.
I'm Brenda Gregg. I work for the Alzheimer's Association, and I've worked in evening services for more than 20 years.
My name is Doug Meyer. I work for Novus Life Care Home Health and Hospice. Been in healthcare for about 17 years, and a fair amount of it has been meeting with families that mom, dad, brother, sister has dementia and Alzheimer's. It's not fun.
I'm Justin Groves. I work at Claire's Court down the street. I worked in senior living for 12 years and a year in the health center at Claire's.
I'm Angela Shaw. I'm also at Claire's in activities in the lifestyle department, and I also grew up. The woman that raised me, my grandmother, had Alzheimer's for 20 years, and I've been at Claire's for 4, and that's how long I've been in the industry.
And I guess I'm last but not least, I'm Tyler McCoy Harms, and I'm the Northeast Kansas Outreach Coordinator for the Heart of America chapter. And I've been here a little over a year and a half, but I've been in the nonprofit field for around 13 years. And I have a personal connection to this disease through my grandmother on my mom's side, who passed from it in 2007.
And I'm Bonnie Smith. As I said, I'm a volunteer with Alzheimer's, but in the work life, I work with Benton houses and have for the last 4 years. And I've spent the last 10 years in this industry between hospice, senior independent living, assisted living, memory care. My own family, my parents, my mother had dementia. My in-laws had dementia, and I have lived through it in my own life, as well as helping other families go through it. So one thing that really strikes me here is there are so many of us, almost everybody here has had a long connection with elders and with dementia. And I think we all probably share that frustration of those newbies who are coming in. Sometimes they're really young, they're not emotionally mature. This type of material that I'm going to go through today might be reminders for you. There may be some new things for you, but I really want you to be thinking too, how important would this information be given to our new folks who are coming in with training? Maybe your company has training that they do, but sometimes those companies, it's just like, you come in the first week, you do 40 hours of computer and nothing sticks, and without the context. So let's today, as we're going through this, not only for ourselves, kind of getting settled into this, but try to think how you can help the younger folks who are coming in who this is new to, okay? And the Alzheimer's organization, yes, they do more of these presentations. They have expanded presentations. We have got such great resources here. We're going to go through, and we've got all of the information is in your packets on how you can follow through the big one. The other one who hadn't introduced, Ivory, the golden retriever, is walking around, or maybe she's okay. Great, Stephanie. She's our Benton House therapy dog. So wherever I go, she lives with me. I'm her handler. So wherever I go, she goes. So we get her today. Please don't give her any treats if she bids. Okay, well, with that then, let's go ahead and step in. We're actually going to cover two topics today, effective communication and then also dementia behaviors. So we're going to start with effective communication strategies. And the objectives of this presentation, what we're going to be learning today is how best to communicate with people with dementia and the progression of how they communicate changes. As they progress, they are losing their ability to maybe to use verbal words. What does that progression look like? And how do we need to change how we handle and operate, work with them? And we're going to also then identify strategies for as things progress, and especially to get to the middle or end stages, it can be pretty difficult sometimes to understand what it is that what their behaviors are telling us. How can we better understand and work with them? Okay. So the first slide, and I don't know if anybody's on the Zoom call, by the way. Is anybody on Zoom? Do we know?
Yes.
Oh, Brett and Lisa. Hello. Sorry, we didn't have you introduce yourselves. Maybe if you want to put it in the chat or something, we can take a look at that later. But thanks for joining us. Okay, so the first slide is this word bubble, and it's really at the heart of everything. That what is communication? Communication isn't words. It's just not the verbal stuff. It's not what we say. It's not what we hear. 97% of communication is nonverbal. 97% is nonverbal. So even if somebody has lost their ability to speak, they certainly have not lost their ability to understand, to be looking at nonverbal behaviors, our posture, our tone of voice, our inflection. That's still really important in how we communicate. And so as the brain changes with Alzheimer's or other, I'm going to say Alzheimer's, but any dementia related kind of disease progression, we need to understand the changes so we can better connect with them wherever they're at. Because the important aspect of anybody, whether it be Alzheimer's or healthy living, is that connection is communication. And communication is connection. It's really all about helping this individual who is still very much their own soul in a body that maybe has changed and shifted. But we still have to connect with that soul and help that soul. Even before I move into this next part, because this is something I believe so strongly in, a lot of us don't understand and recognize how divine our role is on this planet right now. Having gone through this past few years, especially with COVID, when we're overworked and there's not enough staff and there's so much placed on us, it's easy to forget that we are in a divine place and have a divine purpose. And whether or not they can say thank you to us, it doesn't matter, because what we know is that a person who is trapped in their mind or in their body, we are the only link they have to connect to the world. They're vulnerable, they may be fearful, they may be happy as larks, and we've got plenty of those too, but think about it, you are the connection that they have for any needs that they have, for joy, for sorrow, for understanding. So give yourself credit for what you do. And please make sure when the new ones are coming in, the new hires are coming in, thank you for bringing them in and being a staffing coordinator, that they understand too, this isn't just a job. Working with people with dementia isn't just a job. It's not like, working at McDonald's or Amazon warehouse where we know they could be working. This is a purpose and a place on this planet that is so badly needed. And so here we are, and I'm speaking to the choir here. Thank you for being here. But let's just group together and recognize that a lot of the ones who are new to this industry don't get that. And they need us to help reinforce that with them. As we are going through this communication discussion, a lot of what's going to be discussed is the need to just be calm, to not rush, to take our time. Is our society at all set up for that? When we get, yes, yeah, especially when we don't have enough people to do the work that has to be done. And I say has to be done in quotation marks, because we know that the most important thing is that people feel loved, right? The showers might not happen when the showers are supposed to happen, or, breakfast might be 10 or 15 minutes late. People need to feel loved, okay? So this is the other aspect of helping those who are coming in to work with us and to work with dementia. We may need to help them with the tools, right? To stay calm. A lot of people don't know how to stay calm. This is the instant gratification, run. No, so I want to do a real quick one exercise real quick before we get into this, okay? And it's just the breathing, grounding exercise. 4, 7, 8. Going to take a breath in for 4 counts. We're going to hold it for 7 counts. And then we're going to exhale for 8. Okay, we're going to do that 3 times. And I'm going to encourage you to make this a practice in your own life. If you're feeling stressed, before you respond or react to something, no, just get grounded. Okay, so, well, you know what? We're just going to do 1 for the sake of time. You guys will get it, but in your car, do it 3 times. Okay, so let's breathe in 4 for a really deep breath. 4 counts. Breathe in. Hold it for 7. 1, 2, 3, 4, 5, 6, 7. And now exhale for 8. 1, 2, 3, 4, 5, 6, 7, 8. Okay. Do that 3 times. Your heart rate's going to go down. You're going to be calmer. There's going to be world peace. So with that said, continuing onward. So as offices and people lose their ability to communicate their thoughts and feelings through words, they become much more using their own behaviors, right? And they're looking to us for behaviors because they may not be able to understand the words we're saying either. And so let's just connect with them where they're at. In the earlier parts of the disease, so your mother, Tina's mom was, I'm sorry, I shouldn't be using Christina. Okay. That's okay. Anyway, somebody in the room has indicated that they have a family member who was recently diagnosed. And, at an early diagnosis, people might be, getting forgetful or, leaving the stove on or those sorts of things. And at that point, when we communicate with them, we can still verbalize. The important thing is we still need to connect with them and help them feel like they're not being a burden. A big part of them not being a burden is us not being too rushed and making it look like everything they do is just taking time away from what we want to do, right? We can still ask them, how can I help you? What can I do? What can I do to help you? How are you feeling? What can I do? And you can still, at this point, gratefully have those conversations. But as it progresses, you're going to be moving from that easy conversation to using more of body language and then using the 5 senses. So going forward, we're going to be kind of talking a little bit about that body language and the 5 senses. So going on to the next slide. And that might be video, actually. No, okay, so the changes you might notice in the early stages are difficulty finding right words. I said to somebody here, this to me is the paranoia slide, because I can relate to so many of those things. Difficulty finding the right words, right? Taking longer to speak or to respond. This society, we are also very much apt to talk over each other, to not let people finish sentences. I'm so guilty of that. TV shows these days, if you watch like Friends or Ted Lasso, they're talking over each other all the time. You have to be really quick to be getting it. Folks with even early onset Alzheimer's, it's very difficult to follow things that quickly. You have to provide more time and more space and speak more slowly and allow more just dead space between when you ask a question and when they answer. It might take them few seconds to formulate those thoughts and answer. So be a little bit more comfortable with silence. Okay. They might find that they're withdrawing from conversations simply because they know that they don't really remember. And they're kind of ashamed or afraid. They think people might pick up on their lack of memory and inability to follow along. And then struggle with decision making or problem solving. And we can go to the next slide.
Communicating in the early stage.
Sorry, Tyler.
That's okay.
I was trying to get rid of that feedback, guys, and turn the. Okay. There we go.
Communicating in the early stages of dementia with the person with the disease is important. At that time, you still have language as a tool, so you can learn things about what they might prefer as the disease progresses. For example, as the disease progresses, a person might have difficulty finding words. Caregivers often struggle to know what to do in that moment. Early on in the disease, you can ask. You can say, if you ever have trouble coming up with a word, would you rather that I jump in and give you the word, or do you want me to wait and allow you some time so you can find it on your own?
So, these are the times to have the conversations too about when things are further down the road. What are your wishes? What do you want? How would you want us to respond? How would you want to live? How do you want to be? You can still have these conversations, but you do need to keep your sentences direct, straightforward. No need to pull out the fancy vocabularies or anything. Just, be honest, sincere, direct, and to the point. And allow extra time for conversations. Just, again, like I said before, just allow that white space, allow time for them to process things, to think about things before they respond. And whenever possible, certainly, especially at this point, or at any point in the state, in the disease actually, but never talk over them, never talk as though they're not in the room. Ask them at this point, you can still ask them, what they want to do, how they want to be. They can answer for themselves at this point, which is a real blessing. Okay, and then the next slide. So keeping in mind these steps in terms of, don't make any assumptions about their ability to communicate. Especially if you're meeting somebody for the first time, in a workplace, and they've come in and a family's just brought a family member in, what have you. Start that conversation with them like you're with a peer, and kind of, never talk over them, never be patronizing. Just allow them to kind of show you where they're at in their process and really respect them as an individual that way. And then start to explore which method of communication is most comfortable for them. If it's somebody who's maybe not even in your community yet, and they may even be looking for themselves. I've had people call looking for themselves. So check in. Oh, do you need something, Brenda? Oh, okay. So check in. Hello. So check in with them and see, how do they want communication? Or, is email, do they use email anymore? Or can they do computers or text, phones, or do they prefer phone calls or in-person conversations? Find whatever way you can to bring humor to the situation, not necessarily to their disease, but to the situation. Life is too short, whether we have Alzheimer's or not, right? Let's find some ways to laugh and bring levity and joy to their situation. And then just be honest and frank. Alzheimer's, they know, even in the later stages, folks with Alzheimer's, they know when you're not being honest. They know when they're being lied to. And if you lose that faith, that trust from them, why would they believe anything you have to say? There are so many ways you can be honest without having to be like throwing it all out on the table with garbage, right? So anyway, certainly, and at this beginning point, you want to make sure that you're building trust and that they know that they can have trust and faith in you as things begin to continue to progress. Okay, then we're going to move into the middle stage. So what you're going to notice here is that, it's just getting more difficult, finding the right words. they might start repeating things a lot, repeating the same words. Inventing new words to describe familiar things. Let's see. Brenda, were you talking about, was it your grandmother who had said she couldn't remember the word basement?
Yeah,
So
we called it the room under the kitchen.
the room under the kitchen, yeah. So making and this could actually be kind of a fun part of dementia, I think, how many ways can we do, how many words can we use to describe something? Easily losing their train of thought. Again, speaking less frequently might be because they're a little bit, might be because they're ashamed because they know that they're losing their thoughts, or it may be honestly at this point that they're just beginning to kind of lose connection with things and their mind just kind of drifts off in the middle of things. And then this is when they're going to start communicating more through behavior than words, especially frustration and any apprehension and anxiety and things like that. If they can't verbalize those things, they might start acting out a little bit more in nonverbal ways. Other things that you may notice is difficulty organizing words logically, reverting to speaking in a native language. If they've moved here from another country and they've been speaking English for 40 years, and all of a sudden English is gone, but boy, they can speak that, Spanish or French or whatever language beautifully, using curse words. Now, this can be kind of funny, can't it? I mean, have we all seen the church chat lady come and move into our community and all of a sudden drop the F-bomb or something, It's the disease. It's not probably that she's been repressing that F-bomb her whole life or anything. But it is, we don't have to make too much of a deal of it, but it is kind of entertaining and sweet. And, they're just words. And if they, in their right mind, knew what they were saying, they would just be aghast. And then relying on gestures instead of speaking, that. Yeah. I guess you want Mr. Smith, would you like more coffee? All right. I think we've got another video coming up here.
I would advise couples, and I usually do advise the caregiver who comes to the group and is caring for a spouse, that you take your time. Always count to 3 before you respond, because it gives you time to think about your answer and what's going on. Generally, in a marital dispute, it's quick. It's back and forth. You're quick to give an answer. When they've been diagnosed, to sit back and say, okay, you're supposed to be the one that's reasonable here. Let's change how we do this, because there's only one thing you can control, and that's you. You cannot control them and their process.
Right. We're the ones who are responsible for adjusting our behavior to help them. That's what we're here for. That's why we're divine. That's why we're turning into Mother Teresa's over time. A couple of other things is that they might, at this point, it's difficult for them to start to understand, or Alzheimer's uses the term to decode what others are saying, to be able to hear the words and understand exactly what those words are. They may have lost their ability to do that. And so this is when we start using more of our body language in our family as well. So to connect with the person, approach them gently. Again, this comes back to our demeanor is going to speak a whole lot more than our actual words are. And whenever possible, just practice gentle, calm grace. Do those breathing exercises as many times as you have to. Eventually, it will become habit. Eventually, if you do this and if you're really conscious of this, it will actually change your whole life, because you'll learn not only are you able to do this with elders at work with dementia, but you know what? You may be able to start doing it with your children when they come home from school and they're acting out, or with your spouse when your spouse or your partner is asking for something that just seems like way too much. Like, you know what? Just breathe through it. Just be gentle. Something important in the middle stages that becomes more important is the vision, okay, with Alzheimer's especially, people begin to lose their vision. And it may be that it's like the periphery and the top, they may really be able to see only what's in front of them. You know, that's why a lot of times they don't realize they've spilled on themselves because they don't see that. So when you're talking to them, you really need to stay with them at their eye level. So approach them from the front, eye level, and identify yourself. I mean, you may find there may be people you don't need to identify yourself with, but you know, there may be others that even though they've been there for 5 years and you've been there every day they have been, they can't remember their name. So always address them by name. You know, hey, Carol. Hi, I'm Bonnie. You're down eye level. Now, and why is it important to come to the front? Does anybody know why it's important to come from the front?
Well, because if they don't have their peripheral vision, you could scare them.
Right. They not only do they, you know, not be able to see you, but in their mind, if they don't see you, if you're not there, where is this voice coming from? It can be very fearful, hearing voices. Exactly. They do not have the analytical thinking skill to think, oh, somebody's behind me, or somebody's behind that door, or somebody's on the other side of the counter reaching down to get something. They don't have that. And you can really put them in a spin if you get them in that fearful state of where did that voice come from. So please approach them from the front and remember, this is what you're going to be taking back and helping teach all the young ones coming in, right? Before they come back to the Alzheimer's training. But this is so important because if somebody gets a little bit on the freaked out side, we know how long it takes to calm them down, right? It's much easier just to keep that calm space to begin with. I love this. Can we ever talk anybody into dementia or with dementia out of whatever they're thinking? Is there ever any reason to try to argue with them or criticize them?
No.
Not going to win. Don't even try. Don't even try. This is the time to be calm and peaceful and amused, right? We need to get to their space, live in their reality. And for those of you who are the creative sorts who always wanted to be a thespian or, you know, this is the time to really have fun with your imagination and figure out, you know, where exactly are they right now? What are they doing? Get in there with them, get in their minds with them. Because then if you're in their minds with them, looking around as you think they may be seeing it, maybe their behaviors make perfect sense, you know, but just get there with them, spend that time with them. Rachel File, does anybody, or Naomi File, has anybody done any training with Naomi File? Yes, okay, Michelle has. She had some wonderful advice. I really loved, I got to spend a little bit of time with her. And, you know, she was talking about, you know, the people who are like frantically looking for their child. I can't find Tommy. Tommy's gone. I can't find Tommy. And, you know, we have these experiences, right? It's some of the behavior, maybe it's more of the behavior piece than the communication, but it's, can't find Tommy, can't come in. Instead of saying, oh, you know, Tommy's your son and he's 80 years old now. It's okay. He's okay. He's got grandchildren of his own. He's fine. That's not going to mean anything to him. But you don't want to lie to them either. You never want to lie. But what can you be doing in those kind of behaviors? It's all communications. It's like, oh, Tommy, I bet he was just a sweet kid. What did he look like? You start engaging them, not that you're quizzing them on history or anything, but engage them in Tommy, what it is about Tommy, because what might it have been about Tommy? Maybe this person lost Tommy at a state fair 90 years ago and has never gotten over it, right? So you just gotta talk through, communicate through it, just be there with them. Don't try to bring them to this present moment with this cup of coffee yet, just be there with them. So let's see here. Let's go on. I think there's another video here, isn't there?
That there is.
She could sense my frustration because occasionally I would lose my patience and I would bark at her Why are you asking me that question again? I just answered that question 2 minutes ago. And then she would get frustrated because, you know, she was very old school and she's like, don't disrespect me. And I didn't ask you that question 2 minutes ago. It's a new question. So phase 2 of our relationship was like, okay, that's a new question. I'll answer it again.
The repetitive questions, I know it can be wearing, but again, turn it around, it can also be amusing, right? Just keep responding to those repetitive questions or what have you. Join them in the reality. And then it might just take you a while, but just listen to not just their words, of course, but their body language. Figure out really what it is that they want or need. Maybe the words that they're saying is not really what it is that's bothering them. There may be something else. So you're going to have to pay attention to their words and their behavior. Because something on that deeper level, you know, if you're, say you're trying to, say one of the ladies takes a sweater from another, and you know, it's not, you know, this happens all the time. You know, taking that sweater may not be that she just really wants that sweater. Taking that sweater may be that she had a sweater like that when she was 18 years old. It was her favorite sweater, and she really loves that sweater, and she wants that sweater. You know, it's, okay, we'll talk a bit later, I guess, more when it comes to the behaviors on that, but it all comes down to the communication aspect of just being calm and just being gentle and just being loving. Don't let things rattle us. As hard as this is the hardest part of our job, but it is probably the most important thing. Don't let things rattle you. Just try to stay on that even keel, even calm keel. And you're going to find things that, I mean, they're going to feel love. When they're feeling love, they're going to feel more secure. When they're feeling more secure, they're going to be just easier to be around, happier to be around. And our jobs will be happier too, right? Always let the person know that you understand what they might be feeling, okay? Even if you don't quite understand what they want, whatever emotion they're acting on, if it's anger, if it's sadness, if it's fear, you know, just let them know, hey, I understand. You're sad right now. Now I'm kind of sad too. You know, you can share that with them. I'm kind of sad too. And be in that place with them for a little bit. You don't have to, you know, you don't have to pull out a clown nose and make them laugh or anything right away. Just be in that space with them for a little bit. Let them know you get it. You understand them. You're there for them. And then you can move into the next part, which would be kind of directing the behavior into something that's more positive. All right, and then the next slide, talking about multiple cues. I think. Yeah.
Oh, there we go.
Okay, there we go. So at this stage, again, because the verbalization isn't really there, we're going to have to use multiple ways to find out what they're talking about and to communicate our own words or needs to them. So multiple cues. So visual, avoiding sudden movement. You know, don't be too abrupt or anything that could startle the person. It might help to write things down for them to make the little or big calendar on their door. This is Tuesday. Actually, no, this is Wednesday. You might even want to do things like label photos in their rooms. If they've gotten to the point where they're not remembering the names of their children or their grandchildren, you know, you make little name tags or what have you, put them, it might be helpful, may not really be necessary. They may be just as happy as can be, not knowing who that person is, but you could label things for them. And then when you're talking with them, if you have a question for them, especially if it's relating to their care, instead of just giving them an open-ended question, like, what do you want for breakfast? It's breakfast time, what do you want? Well, I don't know. It's like if my husband asked me that question, I don't know what I want. It's like, oh, I don't know. No, just kind of keep it basic and simple. Hey, it's time for breakfast. Do you want eggs or do you want oatmeal like you usually have? You know, just give them 2 options or something. Same thing with clothing. Don't just open the closet, show them, hey, it's spring. Look at all these beautiful clothes. What do you want to wear? How about selecting a couple of things and giving them that option, right? And then, using very slow, basic words, taking your time, being patient, can't reinforce that enough. You're gonna have to sometimes repeat your information or your questions. You may not the first time. That's okay. Just repeat it, gentle. Turn negatives into positives. And this is my forte, actually. I'm always the person who sees the glass half full. Never been a problem for me, but seems to be a problem for other people in the world, and I think I annoy them. So, but this is the deal. So for instance, the whole showering thing, right? Hate getting in the shower, don't want to get in the shower, don't want, no. So instead of saying, okay, it's time to get into the shower, hoping that they're gonna like it this time when they never do, it's like, hey, guess what? Today is Wednesday and it's happy hour and we've got the musician coming in and let's get all cleaned up and put on your prettiest dress and go and maybe we can dance with Dan, right? So you're finding ways to engage them in a way that you know they're going to enjoy that experience, they're going to enjoy that day. You may still have some hesitancy. I mean, it's not a perfect word. It doesn't always work, but it certainly can help and you can keep trying. And it's amusing to try along the way, right? So it's going to be a whole lot better than just saying get into the shower. And avoid quizzing the person and try to coach families on this too when you're dealing with them. How many times have you seen a family come in with little Susie, 8 years old, and they say, do you know who this is? Like, no, I don't even know who you are, right? So try to coach ourselves, you know, don't look at like the picture books with them when we love to look at like their family photo albums. Let them just enjoy the albums, enjoy the pictures. You don't have to say, and who is that? And who is that? And who is that? Because they may not know, and that is really frustrating for them if they don't know. And then they, you know, maybe they don't want to do that anymore because they feel like they're failures or whatever. When you're looking through those notebooks or those photo albums with them, just, you know, boy, what a handsome guy. Look at that beautiful wedding picture. Oh my gosh, I wonder what that wedding was like. And they, you know, you get them to talk about things more than asking them any particular details of that situation of the day. And that's, please help coach families on that, because I just see that so much. Don't you? When they come in, they just don't quite get it. Maybe it's just habit. It's just the way we talk to others. It's just habit. Okay, and then we're going to move on to the next one about the late stage communication. This gets pretty severe. And so with late stage, they're not verbalizing much at all anymore. But they still need to connect. They may be laying in that bed or in that chair and rocking back and forth, not saying anything, but they still need to connect. So still be there for them. And some of the things that you can be doing to help them is, first of all, you're going to want to remember, again, you're not looking at a person with dementia. You're looking at a soul there who is trapped in a body that has dementia. They may not be able to show you outwardly what they are thinking or feeling, but they're still thinking and feeling. So what are some of the things that we can do? We can really rely, of course, on our nonverbal behavior, just being gentle touch, gentle words, gentle voice, looking into their eyes. I mean, how many times have you done? It just brings me to tears sometimes when you look into their eyes and they stare back at you. And there may be a little bit of confusion, but there is also kind of a warmth or a softness that they feel safe. And you can tell they feel loved. That's such a privilege to be with a person at that point, that we're able to be with a person and connect like that. But then the five senses are really ways that at some point in time, it's really going to be the five senses. So, you know, touch. Hand, you know, getting that hand lotion out and giving them a hand massage or a foot massage, or just stroking, brushing and stroking their hair, stroking their arms. For sight, take them if you can, like outside or to a window and show them what a beautiful day it is, or the birds that are coming around the feeder, and Did anybody, when you were driving in today, did anybody notice like the blossoms from some of the redbuds and the crab trees it was windy enough out today that they were like blowing it's mystical. It's so beautiful. And if you're seeing those things around you, if you can point them out to those individuals, it really, I mean, this is what life on this planet is all about. Let's help them enjoy it as long as we can. Sound, of course, music, you know, whether or not you like to sing, doesn't matter. Sing anyway. They don't know. It's make a joyful noise. But the research has indicated that for those that music really touches us and connects with us especially between the ages of 14 and 30. That's the music that really embeds itself in our memory, and more so than during other times of our life, which is interesting. But, you know, so try to get the music that you know that may have been their era. Or, of course, if they were people of faith or of a Christian tradition, the Christian hymns or Jewish hymns or what have you, just things that they're comfortable with. And then the taste. Enjoy this, you know, you can tell I enjoy taste. I really totally enjoy taste. She's gonna call full woman out. But enjoy tasteful things together, you know, give them an ice cream cone, but I hope that they're not eating that ice cream cone alone. I hope they've got somebody else at the table with them, or that you're sitting down with them to have that ice cream cone or a nice cup of coffee or hot chocolate. But taste is one of those things that they can certainly appreciate. And especially the sweet stuff, right? That last sense to go. Okay, and then I'm gonna get out of the way. There's another video here.
I know that my mom feels aggravated. I know that she feels alone. I know that she feels confused. And I know on any given day, I don't know if I've made it better for her. I try. In these later stages, I've come to recognize that being really aware of the 5 senses is really important. Touch seems to give her a great deal of comfort. I know when I come over, I'm going to brush her hair all the time. And my husband noted to me recently, he said, you know, you should see the look on your mom's face when you're brushing her hair. She's just happy. She's just happy. She doesn't say a lot. And I do it for a long period of time. I comb it, I braid it, I do funny things with it. But it just allows me to just be with her in a way that makes her feel comfortable.
Okay. These next slides, I'm going to go through rather quickly because I already kind of referred to them, but they just give us some context for the senses, some tips on what we can be doing. So connecting through touch, you know, having different fabrics around, different warm comforters, soft comforters, things, you know, hand massage. Identifying everyday items, put them in a bag. Have you guys played that game where you put things in a bag and they have to try to feel what it is? Visiting with animals. Several of us were talking earlier how important animal therapy can be in homes, and if their own families can bring their own pets, or if your community has access to a therapy pet, that's lovely. Let's go on to the next one. Recite. Pictures, of course, videos of animals, nature travel. I love walking into our communities because in memory care, it seems like if the TV is on, it's almost always the nature channel or Hallmark channel, but the nature channel, and just, you know, watching all the animals and stuff like that. Famous paintings, bird watching, paint with watercolors. Go outdoors, sit by, and I hope that everybody has a community setting where they're able to go outside, especially in this beautiful springtime right now. Those balmy breezes. We go on to the next one. Sound, okay, listening to familiar music, the recordings of the sounds of nature. I love that idea. Identifying musical instruments by sound. Listening to songs or speech in the person's native language. And if you have a diverse population in your communities, that could be very cool to be bringing in, you know, the different cultures and being able to share that with one another and listen. That last bullet point, let that person hear the gentle tone of your voice. Now, doesn't everybody on this planet deserve to feel like they're loved and they're safe and secure? You guys, it's so simple. all we need to do is just be there for them and be present and listen to them and be calm and take time to just look into their eyes every once in a while and give their hand a squeeze. And then the next one. Snow, talking about different things here, plastic bags with herbs or spices or essential oils, grass clippings if it doesn't make them sneeze, teas, coffee beans, fragrant lotions for hand massages. You know, what if they did like Ben Franklin or whatever? I mean, the store Ben Franklin, not the store guy. You go now and it's like there's hand lotions of gazillions of different scents. It's just overwhelming now. You know, back in the 1960s and 70s, was this a thing? Was there this much hand lotion? I'm sorry, just a thought to the side. It's like I was at CVS last night and it was just like, oh man, I don't know.
Too many choices.
Yeah.
Same thing with toilet paper.
Yeah. And then cooking, you know, having food around where you're cooking fresh cookies or having some really fragrant stews or meats or roasted broccoli smells so good. Apple pie, chicken soup, probably better. All right. And then through taste, yeah, having the favorite foods and home baked things. Popsicles, we're coming into popsicle season. That's always a fun one. I love seeing the blue lips after everybody's puddings, ice creams, all of that. Okay, and then finally, we're going to kind of be wrapping things up here with a summary on this last. So kind of to summarize, we can't change their behavior. We can't change how they hear us. All we can do is change how we react and respond and be with them. So make sure that you're just staying as calm as possible. It is very helpful for you to just keep up with information on Alzheimer's, whether it be through the news and, you know, there's a lot of stuff that's happening now with medications that can be complicated, I know, but, you know, the research and the things that are going on, just keep track of how things are going, because this is going to impact this is impacting our future. Hopefully, you know, and it wouldn't be great if in a decade or so, we've kind of got the handle on Alzheimer's and we've raised enough money to raise enough awareness to raise the funds to get that research done. Anyway, always treat the person as the adult that he or she is. Take time to try to decode or, you know, as I say, just kind of identify and understand what's going on with the behaviors, with their words, maybe in their actions. Recognize the effect that you are having, that your body language is having. And it's so easy to rush and not think about it because you've got a lot to do. But by your rushing, making somebody else feel like they're in your way, or you just want to get it over with quickly, they don't really matter. It's just kind of sad. It's something we feel that way when we don't want them to. Try to understand the source of the reactions that you're getting, and then help meet the needs while soothing and calming that individual. So this, oh, one more.
Taking care. Taking care of yourself while you care for somebody with the disease not only impacts your own health, but it really can impact the person with the disease. So for example, if you're not getting enough sleep, you might be easily irritated, which will then sort of spill over to your interactions with the person with the disease and maybe being short with them, which then might cause them to get frustrated. So it's not only important to take care of yourself for your own health, but really for you to really be a good caregiver.
Well, that's good advice for all of us, and certainly for the families that we are helping who are still managing at home or, you know, even coming in and trying to, you know, spend time with them. So we'll kind of skip over, not that we're going to be skipping over this slide, because it's also going to be the end of the next presentation that we're going to go through quickly on behaviors, understanding and responding to dementia-related behaviors. And when it comes to, I'll give you just a minute to pull that, that slide presentation up. So much of this next piece that we're going to talk about, understanding behaviors, all comes back to the core of communication and nonverbal, all of this nonverbal behavior that we are exhibiting or that they are exhibiting. And hopefully we're going to have some time here to, I'm going to go through the slides fairly quickly, because what I really want to do is have a conversation here about some of our most challenging behaviors that we've dealt with, and using the 4-step tool that Alzheimer's is providing here today with one another, try to figure out what was going on with that individual. We're going to be able to identify common triggers for behaviors, explain, there's a 4-step process to kind of observe, identify, and assess those behaviors, and then list some strategies to address some of those common behaviors. So triggers can come from many different, can indicate many things. Behavioral changes have many triggers. So pain or discomfort, overstimulation or boredom, fear, frustration, and then any of the unfamiliar surroundings or change in their typical routine or what have you. And then complicated tasks. It's the frustration of being asked to do something maybe with too many steps or what have you that they can't follow, and that gets really frustrating. So although the causes might be hard to figure out as we're going through these, and as you're seeing somebody's behavior, sometimes it's hard to identify what's going on. But there's this wonderful 4-step way that Alzheimer's is kind of providing or suggests that we use to understand and address their behavior on the next slide. So the first one is to detect see what's going on and connect with that person. Connection. This is going to come up all the time. When you see what's going on, you want to make sure that person also understands you see it, you're there with them, and you're going to figure it out. Okay. So the first thing that you're going to be doing after detecting what's going on and connecting with them is we're going to address if there are some physical needs that they need. That's the first thing. What's going on physically? Then address what might be happening emotionally, which is kind of funny because usually we jump right to the emotional reaction, right? But that's going to be the after physical. And then we're going to take some time to kind of reassess what happened. How did we respond? How did they respond? And if this should happen, or it probably will happen again in the future, how would we do it differently? Okay. So next slide, detecting and connecting. So again, we're going to remember you're always going to join the person wherever they're at in their reality. That's where we're going to be living, to try to see the world through their eyes and understand the person. If we can't figure out where the behavior is coming from, it's our job. It's the game. It's the quiz. It's here we go. We're going to help. We're going to understand where it's coming from. And so we're going to have to maybe be a little bit of detective, a little bit of Sherlock Holmes on this. We go. So the 5 W's: who, what, when, where, how. Oh, that's a glitch. Sorry. So who? Situation happens. Who was there when it happened? What happened before that behavior and what happened after the behavior? Where did it take place? When did that behavior? And then the how is, how did you react? And so as the situation unfolds, you're going to first go and connect with them, approach them respectfully, and just connect with them. Coming from the front, eye contact. And remember that, and this is just when the behavior is just first starting to happen, right? You don't really know what's going on. It's just starting to happen, but you're going to be there right there with them. You're going to be making eye contact with them, and you're going to be making them feel whatever it is that's going on. This person, they're going to help you. They're going to help you. That's all that matters initially. It's just going to help me. And so the next slide talks about first, address once you've connected with them and let them know you're there and you're going to work this out, You have to address physical needs. So, medical. It could be, do they have any, have they had do they have any bruises? Have they had any falls? Has anything happened and looks a little unique or unusual at that moment? Or if they are having really odd behaviors and it happened quite suddenly, is there something medical going on? Might they have a UTI? Does everybody here know about UTIs and how significantly that can change behaviors, right? Or side effects to medications, something like that that might be going on. We've got a great example we're going to use in just a little bit about this one. Hungry? Are they thirsty? Are they bored? There's lack of any social interaction going on. So kind of check, any of the triggers for discomfort. That are their pants too tight? Is it too hot? Is it too cold? Is it too windy? Is there sun coming through the windows? It's glaring and it's hurting their eyes. So those are the physical things you're going to look at first. And if you're not really seeing anything there, now some of this, of course, might be something that you can't just at that very moment work on. If you think there may be medical things going on, you may be having to talk to your medical director or one of the nurses to kind of figure out and look back to see, has there been something that's been happening? Is there anything in the file or in observations that indicate what could be going on here? But then, so that's all the physical things. Then we're going to go to talk and address the emotional needs. Again, you're going to be focusing on how they feel, not what they're saying, but how they're feeling. And some of the things that you're going to be needing to do at this point is you're just evaluating how they're feeling. You can tell if they're sad, if they're angry, or what have you. Focus on the feelings that they're having, not the facts of the situation. Maybe you just observed them having an argument over a glass of juice with another resident or something. The fact is you saw them take the other resident's juice. That doesn't matter. Really what matters is what are they feeling? Why did they take that resident's juice, right? Avoid correcting them. Don't try to say, no, you're wrong and we did this, or, that is not your juice, that's Julie's. Just, again, you're never going to win an argument with somebody with dementia. You're never going to win. So just kind of try to work around that situation and try to understand why it is that they are feeling selfish in the moment and want somebody else's juice, what have you, Let the person know that you're there with them to figure it out. You want to work it out with them. It might take some time, but you're there. Your eyes are right there with them. We're going to get you taken care of here. And then just reinforce that you're there to help. And once you can get them emotionally grounded a little bit, deal with them with that emotion first so that they feel like they know you're their ally. Then you can move them on to a diversion activity, right? Don't try to divert them right away. Let them know you get it. You understand that they're angry, sad, what have you, before you go into a more soothing activity. Okay. And then reassessing and planning for the next time. Okay, so chances are, especially somebody into the mid or late stages, sometimes there are these repetitive behaviors that you're going to see, right? A lot of times it may just be a one-off, but frequently there are some behaviors, sundowning behaviors, or people who like to go into other people's rooms and find things, find the little baubles or what have you. Every time you go through one of these situations and you're dealing with, every time you go through somebody's behavior, you're going to learn what to do better, right? It's never a failure. Never feel like you have failed in addressing somebody's behavior if the outcome isn't what you want, a perfect outcome, what you wanted to be, and everybody's happy and singing kumbaya, whatever. Because every time you go through one of these situations, it's just another way to learn. Next time it comes up, I'm not going to do this. I'm going to try this, right? So how can you make adjustments? What worked? What didn't? How can you make adjustments? And by the way, it's always good to be sharing this with some of your team members because chances are you're not going to be there 24/7. they might be. Not 24/7, we'll just say 8-5 hopefully. Okay, so next slide. Okay, so we're gonna apply these, you can apply this to any behavior. There is an example in this class, or in the handouts of Anne, okay? And so let's talk about Anne, and then I want to open it up to the group. Anne's family comes to visit, or maybe you don't have the handout, I'm sorry. You have to just use your imagination, close your eyes. Anne Margaret's family comes to visit. She's related, she's still alive. She passed away now. She may have dementia. There's a lot of people in this room who don't even know who Anne Margaret is. So
I don't think she's still alive.
So anyway, Anne's family comes to visit, evening begins. Evening is beginning, they come to visit. She becomes very suspicious that people are trying to get into her house and are watching her through the big picture windows. She becomes suspicious of her family for not making the people go away, and they are all in cahoots with each other. Okay, so let's keep Anne's situation in mind and review those steps. So, of course, we're gonna keep calm through all of this. First step is always to take a few deep breaths and not react so quickly, but just, keep calm, analyze the situation. So what do we know about this behavior right now? I mean, we don't know a lot about Anne, obviously. This is just a real quick vignette, but okay. So it's late evening.
It's sundown time, so for.
Mom.
So
okay.
it's one of the most challenging times of the day.
Yeah. Sure, sundowning time. Yeah. Okay, what else?
She's seeing people through the window, so I'm wondering, maybe she's looking out the window and seeing people in the parking lot and thinking that they're coming after her. Or,
yeah.
So maybe just, like you said, to assess, let's figure out where she was when she was talking about this.
Right.
Was she in the building? Was she in her room looking out the window? Was she? So you're looking at before and after or during,
Right. And so we in the family so we may be having to coach the family through this, right? But we're definitely not gonna be saying, oh, there's no fake hope there. No, I don't see anything. Even to say, I don't see anything. I'm sorry, I don't see anything. But, right, it could be, she's seeing you guys thinking it's outside. Could be the way the sun is that time in the afternoon, that she's seeing the group of people standing behind you is a glare in the window. She's seeing people outside, it's just the glare.
something that they had on TV.
Yes, exactly. Something she's seen on TV, working out in her mind. So all of these things. Okay, so we know at this point we're kind of so we've already talked physical needs. We don't know. I mean, we don't know what may be going on. But emotionally, let's talk about this. Emotionally then. So we're going to assume that she's okay, that she's not having a UTI, or that this is something that's kind of a standard sundowning behavior that we're seeing again and again. And we've already reassessed again and again. So we're going to know exactly what to do this time. It's going to be perfect. So emotionally, how are we going to address her emotional needs? Validate her feelings. Yeah, validate her feelings. So she's afraid. What can we do when she's afraid?
Touch, soothing voice.
Yeah.
Establish eye contact with her.
Yeah. See, I feel better already. Maybe even moving her away from that fearful place, right? Moving her to a different room where that window is. I'm curious, I'd be curious to know if you took her to a different room and then closed blinds and brought her back in, if she would still think there was somebody out there, Who knows? Who knows? You'll figure it out as you assess and reassess and you do this the next time. So again, it's always being in their space, never belittling them or diminishing their fears or their concerns. It may be maybe it's entirely in her head based on what she saw on TV or whatever, but still she's afraid. She thinks other people don't understand or appreciate why she's afraid, so they're in cahoots with her, with whatever's going on. So just make sure that that this person is gonna realize that you're here to help them, and you're here to be with them, and they're gonna figure it out together. Let's see here. Confusion or suspicion? This is so, oh, wait a second. Could we go into aggression?
Yeah, we're now in aggression.
Okay,
So I think we were just in confusion and suspicion.
okay, that's where Ann was. Okay, so aggressive behaviors. Okay, so this can be a little bit more concerning, but again, first thing, stay calm, right? In fact, this is, I think, Brenda, I would love to have you share this whole, because we've all had experiences, I'm sure, where people can maybe get aggressive around showers or if they're angry with other people. And sometimes family think, oh, it's just the stage of dementia, this aggressive behavior. It's just a stage. Oh, she's there. She's at that aggressive stage. No, not always. So would you please share that story about yesterday? It was great.
We had a support group yesterday and family was sharing his frustration that the facility where his wife resides called him just recently to report that his wife was acting aggressively. And his first response was, well, why? And they said, well, we don't know, but you need to come have a talk about your wife's aggressive behavior. And one of the things they had remarked was that she was grabbing staff aggressively on the arm and squeezing very, very tightly. And so he went to the facility and he did notice that his wife was acting differently than she ever had before. And so he did talk to the staff about, I do notice changes that is very unlike my wife's behavior, but I think something's wrong. I think there's a cause to this behavior. I haven't noticed this with her before. And he really acted as an advocate. And when they did do a deeper assessment, they realized that she had an impacted tooth. And so come to find out that she was in pain. And so what they had immediately identified as aggressive behavior, when you see it through the eyes of the individual living with dementia, she was acting out her pain because, as we know, people communicate through their behaviors. And when she was grasping on to staff in what was determined to be aggressive behavior, it was a call out for pain, because people with Alzheimer's can't say, my tooth is throbbing. What they do is they, reach out and they squeeze you because they say I'm in pain. So that was a signal, I hope, to staff to say, you really do need to investigate the why. And when you say, I don't know, sometimes and when you say, I don't know, you really have to say, well, find out,
right?
Because they're communicating something. So I'm really glad that caregiver was an advocate and really made them investigate that why. But I did share in his frustration, that he was frustrated that was just, we don't know why. And I'm glad that he was an advocate.
So using that as example, then with the 4 steps of kind of defining and connecting first, what the caregivers in the community could have done rather than assuming that it was just aggressive behavior was really defining and connecting and getting to spend some time with her to find out, knowing it's not in her nature to be like this. There's something going on. What could it be? And, I'm sure that finding an impacted tooth might be difficult.
Yes, and something was, when we go back to those W questions, something that the caregiver, the family caregiver, the husband had noted was we could go back and look at her eating habits. And so when we delved a little deeper, we realized, because that's something he immediately noted, because when he showed up, he had brought her a favorite treat and she said no, she didn't want that. She didn't want the favorite treat. So that's why something that he noted back to the staff, why we noticed she was acting different. She didn't want my favorite treat. And so then looking back on it, I think that would have been a clue. Oh, she's not eating like that. That could have been a clue too. So look for this clues.
Yeah. So those types of clues, but and again, instead of responding by calling somebody an aggressive person versus taking some time. And again, it might take detective work, and it's not an easy job, but it can be very, we all need challenges sometimes, right? So, and get the team to kind of figure out what's going on. We need some more. Are there any other, I know that there's a few other slides here, but I really wanted to spend more time on this because we've got so many years of experience. I would love to hear other examples, and we've got just, because it's 4:29.
Yeah, we're at time.
Oh,
So
we're at time.
what I would say is just in honor of everyone's time, if you need to go, feel free to go. If you'd like to stay, we'll continue to talk about it, but I don't want anybody to feel like they have to stay.
Yeah.
Because we're right at 4:30.
And there are, if we go to the end of this PowerPoint presentation, the things that I did want to make sure, and maybe it's in your packets. Do they have the packets of all the toll-free number to call 24/7, the hotline? Is that in the packet? Okay.
It's on this.
Yeah, 24/7. That's for those of us who work professionally. If we need help, that's for family members. Get that out, share that information, please. And there's just a wealth of information, of course, around this table with those of you who bring all of your experience. So if anybody wants to stick around to share a particular challenge that has come up or behavior that has come up and how you detected it and worked it out, I would be, I'm willing to stick around and listen.
I wish we could say we have to go back.
Thank you so much.
Thank
So
you
nice
for
to meet
coming.
you.
And I wanted, somebody mentioned that there was a workshop for the family members.
Yeah, so before one speaks out, I will just say that if you guys have seen anything here, if you feel like this would be beneficial for your staff and your community, or if you have somewhere else that you feel like an education like this might be helpful, my card's in the packet. Feel free to reach out to me. We can do something very similar to this wherever. So
For personal.
are you talking about like a support group? Or caregiver training?
I have my closest girlfriends that I grew up with, their mom, they're currently. They're just, I mean, I can tell them all the things they need to, you know, like, I can share my stories and the things that I do at work, but I feel like they really need
Something like this.
resources,
Yeah.
they really need.
Just reach out to me,
Okay.
email me, and I'll send you a link
Okay.
where you can go and they can sign up for some. We've got educations like this going on throughout the city weekly.
I just feel like they have resources, and it'd be great to get
Yeah.
them, I mean, again,
Sure.
I've done this for a few years, I'm
Yes.
sure my knowledge is helpful, but they really need to realize.
Yeah.
Great, thank you so much. Thank you, thank you.
Yes.
Hearing you guys say volunteering. Yeah, what is volunteering?
So it's in your packet, the way that you can volunteer, but you can do one way is you become a community educator like Bonnie. And we would get you trained up and give you all the information and resources you need to do an education like this on your own. Which Courtney and I have talked about, but it's the offer to have more than one of you volunteering. The other support group facilitator, and I think we're going to do a support group for that as well. Brooks, the community educator, who just finished her education.
Awesome.
For that. So,
My name's
yes.
Dan, by the way. Oh, hi, Dan. I met you somewhere before. Were you at the walk at Liberty Memorial?
I'm sorry, I'm gonna stop this recording and I'll be right with you.
Good to see you. Yeah.